Hi, my name is Candace Potter, and today I'm going to talk about implicit bias. So what is an implicit bias? Implicit bias is the subconscious feelings, attitudes, prejudices, or stereotypes that one feels or has developed due to prior influences throughout their lives. Today I will be discussing the implicit bias on eating shame. So what is eating shame and how can it affect patients in the healthcare setting? Food shaming is the negative reactions, feelings, and commentary that is directed towards a person's eating habits and choices, comments, beliefs, and attitude about one's body, weight, and diet. It often involves body shaming, diet shaming, and shaming foods of a different culture. Food shaming can cause depression, anxiety, and embarrassment. It can cause lifelong self-esteem damage and damage or harm to a person's relationship with food. It can lead to someone having body dysmorphia, anorexia, or bulimia. Some examples of bias of food shaming in healthcare could be as we all have that one friend or family member or know a story about someone who went to their primary care physician for a symptom or a health issue that deserved or warranted a standard workup. But when they got there and spoke to the doctor, they were told that they were overweight and that they needed to go on a diet without really addressing the real issue or problem at hand. The patient walks away feeling dismissed and disappointed and maybe even possibly depressed because you're trying to be seen for healthcare and it's getting swept under the rug and you're just told it's about your weight and what you eat. Another example would be about a patient who wanted to get her medical records from the primary care physician or office that she was being seen at. While reviewing the medical records, she realized that she was called pudgy or big boned in the medical records, and that left her feeling insecure about herself and wow, the doctor thought that I am pudgy, and that should not have been put in the record, but the person who put that in there wasn't really thinking that the patient would see it, and it left her feeling heartbroken. Another example would be when a patient goes to the doctor or the primary care to be seen, and because they're a little bit larger, the first thing that they hear from the doctor is that you're a little bit overweight and we need to put you on a diet. And the doctor or the physician that they're seeing automatically assumes that they don't eat healthy or they don't like healthy foods, and that is not the case at all. Another problem with food bias is that there is a dominant message going around with food and culture. There's a lot of people who have strong opinions about what you're supposed to eat or the particular foods that you're supposed to eat. There is a level of morality attached to your behavior if one does not eat a food that others think that you should be eating pertaining to the foods of your culture. I myself do not eat pork, and I have not had pork for over 2 decades, and I cannot tell you the amount of questions that are asked to me on a regular basis, the biases that I receive at work, with friends, and even family as to why do you not eat pork? It is a personal decision, but even I am exposed to that very often. Because there is so much implicit bias around food, nutrition, and diets, someone can walk into their physician's office, dietitian's office, and the first thing that they hear is that you need to lose weight regardless of the reason for their visit. It's unfortunate, but a lot of providers have implicit biases on patients' body weight, and I don't think they mean any harm. But a lot of the times it is the first thing that you'll hear is that you're overweight and you need to address that. The problem with that is that physicians do not take the time to understand that eating healthy looks and means something different for everybody, because this is a problem that everyone faces at some point or time in their lives. We need to implement some interventions that can be used to ease or eliminate biases with this conversation regarding around food and nutrition. So the first thing that we can do is be aware. Awareness is key in regarding biases. Be aware that food shaming is a real thing. It really does affect people and can emotionally damage someone. One can be neutral. Being neutral with the perspective when discussing food and nutrition. Have more conversations about what is their access to quality foods, how to prepare the foods, and ensure that the patient does not feel bad about their food choices. Partnership and building relationships with the patients. Building those relationships with patients and their families when you come from a place of common goals and partnership, also friendship. When you come across with a caring, common goal attitude, you are going to not offend the patients as much if they see that you are being genuine and care. And be a positive role model. If you're going to discuss diet and nutrition with someone, it is much easier reciprocated if the person discussing such topics demonstrates and shares the same key values that you're expecting from someone else. Food and nutrition is a topic that can easily offend others. We should all do our part to ensure we are respecting everyone, who they are, and be kind with the words that we say.